Welcome back to part two of the Voices of Healthcare Equity. I am having this conversation today with Stephine Ogutu. Steve is a wonderful guest, the country director for the Movement for Community-Led Development and board of director member of the Global Telehealth Network. And we were just talking about our visit in Kenya in April and the project we are setting up in partnership with Global Telehealth Network and Healthcare Alliance to bring a telehealth network in Kenya and also in Uganda. Within the next couple of months, we're working on our partnerships with government entities and waiting on some MOUs, and then we will be ready to get started. We have infrastructure in place. And Steve has really been helping us understand a little more about how the devolved government structure in Kenya puts the responsibility for healthcare in the county, in the 47 counties within the country, in their realm of control, and how governors are stepping up to meet that with things that are low cost and highly scalable and high impact initiatives, such as telehealth. Steve, I'm wondering if we could start part two with just a quick primer on what the national healthcare structure around clinics looks like with your referral hospitals in the city, and then going down to the village level, and then let's from there we'll proceed to talk a little bit more about the really special needs of each kind of facility as we talk about building support structures with telehealth.
Kenyans, like you've said, we have a devolved units, devolved system of government. And health is one of those devolved functions. And so what this means is most of the key components and services of health are devolved. So what the national government is left with largely is policy. They are still in control of the policy, because health is not just a personal matter, an individual matter. It's also a security issue for the country, and so the national government is still holding the policy part of it for regulations and for quality control and all that. But when you go down to the county level, I think the highest level, hospital level, is level 5, like the one we visited in Makueni in Water Town. And that is where you find a lot of specialty, you know. And second to that, of course, you will now go down to clinics and dispensaries, down to the villages, and all these are coordinated from the county level, the level 5 level, that then provides, it's a backstop. It backstops a lot of things that cannot be done by the lower level hospitals. And then at the county level, there are also certain specialties that don't exist. I think, like, you have the head of hospital there saying that there are also certain medication that cannot be found at the county level, that can only be administered at the national level. And here they're talking about referral hospitals, like the Kenyatta National Hospital. We have others like the Eldoret Moi Teaching and Referral Hospital, and many others, a few others. There are not so many, a few others that are spread across different regions of the country. So that is how the health structure is. And there's a lot of coordination, both at the county and national level. There are a number of technical working groups that help with the coordination of just to ensure that the response to Kenya health needs is streamlined, it's responsive, and that Kenya really enjoys the services that they need.
So here in the U.S., I do a lot of rural healthcare, and I work in what we call critical access hospitals and Indian Health Service hospitals, which are considered rural and small hospitals. And I have to say, in a rural and small hospital, um, in my smallest place, I'm the only doctor there when I'm there in the emergency department. But we have a CAT scanner and we have radiology and we have lab. We don't have all labs. We have most of the labs you need for emergency care. We have limited blood supply. We do have some limitations on drugs. And the reason I bring that up is because that's considered sort of uh, the lowest level of emergency care you can get in the US. And the comparison for that in a country like Kenya or Uganda is a regional hospital, which is a level 4. So level 5 would be the national hospital. So that's actually a really high level of care to access. And what we're talking about, the places we're talking about supporting and bringing equitable healthcare access through telehealth are small clinics that are an hour and a half by motorbike only, because these are dirt roads. They weren't developed for cars. They were developed for people and animals and such on a motorbike. So an hour and a half ride from motorbike, you have your local clinic and dispensary. And what they have is generally a nurse and very limited supplies. So we visited clinics where the midwives deliver people and they do a great job and they do it safely, but they have limited tests. So they have point of care tests. They'll have HIV, syphilis, pregnancy tests, the simple things you need to deliver a baby. They have simple bulb suction. They don't have expensive equipment. They don't have x-ray. They don't have radiology. Um, and the impact you can make by having a specialist who normally does have access to all of these things be able to support a midwife in that situation to make a life saving intervention is immense, right? You can even bring ultrasound into those areas and be able to change the trajectory of a difficult birth or a placenta previa. And I don't want to get too medical. But I just wanted to give people perspective on what kind of clinics we're bringing care to and where most people in villages or rural areas are getting their care. They're not getting it in a regional hospital system. So thank you for that, Steve. So, and with that, I want to go back to um, what do you think are the most important next steps to improve health equity in Kenya?
Before I go to the next steps, I just want to echo what you have raised there. Very important bits that you've introduced in your context there, and it's true. Even what we call the level 5 hospital, which is the highest at the state level here, the county level, as you noted, there are not enough doctors. We are very, very stretched. Maybe you will find one surgeon or two, and you're talking about a county with a population of close to 1 million people, and it's far removed from communities. So a mother or a grandmother who who cannot even afford to live, who lives under $1 a day, um, is forced to choose between health and food, and that is a very serious moral challenge that we're experiencing as a country. And therefore, and when you move also to the village level, where you said we have dispensaries and these other facilities, clinics, um, we also don't have qualified medics there. Mostly it's nurses, or also in some cases is what we call the community healthcare workers who have some level of training to administer medication, to test temperature, and those basic but very important health aspects. Um, and therefore, it takes me back to what I shared earlier, which I think is now our next step. Is I hope that I'm really hopeful that with this collaboration that is unfolding with the Health Alliance, with Equitable Wealth, and then GTN and LCOD, will really uh, help address some of these needs. I'm looking at how we have structured the collaboration with the first phase of the county governments that we are working with. We are looking at institutionalizing telehealth and then enhancing the capacity of county governments. I'm saying enhancing because, as you noted, in some counties there's some form of telehealth happening. So what's needed is just some little support to enhance what they already have. So looking at that, and also the kind of qualified personnel that and volunteers that you have in your panel that are now coming to backstop, especially in dispensaries and clinics where there are no specialists. Um, and and this will go a long way to save lives of mothers and children who would otherwise die because of a very simple advice, you know, that this kind of platform and collaboration will really bring. Um, Another next step that I see that this is also an opportunity for us to, and for GTN and your organization can look at how we can build the capacity of the national government and the county governments to um, have some sort of policy, maybe review the existing policy, health policy, and embed telehealth or telemedicine or telehealth system in terms of our health strategy to ensure that the universal healthcare coverage, which is an agenda of this current administration in Kenya, becomes a reality. Just recently, I saw the Minister of Health unveiled a very ambitious digital health, policy statement, and that is an opportunity for us and other partners out there who would like to collaborate with you to reach us to ensure that communities really, we work with governments to ensure that communities really get to benefit from these services. At the end of the day, we are doing this for communities, that don't have someone to speak on their behalf or to raise their issues, and we are getting these services to them. And I think that is the most beautiful thing with this initiative. And I'm hoping that anyone who's listening out there and who maybe is touched with what is happening in places like Kenya and other parts of the global south um, can really reach out to your organization, and because you need a lot of support. These things, these kind of initiatives require resources in terms of funding, in terms of capacity, and therefore, I think any any individual, any organization, any donor that would be interested in supporting initiatives like this, supporting your organization would really go a long way in terms of addressing some of these health inequalities that is driving our country and the continent in the wrong in not so good direction.
That's Steve's call to action to please get involved, right? If you are a healthcare, yeah, if you're a healthcare professional, you can join us. You can be engaged in a very real and meaningful way with carrying out this care. And if you are not a healthcare professional and you're a donor, you can get involved and you can support us because it takes resources to make this happen.
And sometimes it's just $1 or two, or just volunteering 10 minutes of your time or 20 minutes of your time. It makes a difference.
Absolutely. And when you do that at scale, it makes a giant difference. I often talk about the 1% impact. If we can get just 1% of all the doctors, and I'm only talking doctors, not all the other healthcare professionals, we'll scale it even more. But even if we got 1% of every doctor currently trained to do just 2 hours of this work, we would have 700 hours every day of physician specialty care to carry out, not just in Kenya, but in other places. And Steve, you are aware of what's going on elsewhere in Africa. And there are other countries, not just Kenya, that are pursuing universal health care and are pursuing telehealth as a really important part of that. Can you share anything about that with us?
Right. I know countries like Uganda, where we also visited during our April trip, during your April trip, is one of those countries where um, health inequalities are still very high. Countries like South Sudan, there they have compounded challenges of conflict, of gender-based violence. Women and girls who are victims of these conflicts that are going on there, need are having challenges when it comes to accessing very basic health, including maternal health and other critical services. And if you go down to countries like DRC, same situation, very chaotic and unfortunate things happening there. And the people who are suffering there are communities who can never afford this kind of health services. And so that is the picture. And the bottom line is telehealth and telemedicine um, is an antidote, is a solution that we need to create health equality. It's an equalizer because one, it's less expensive. It's less expensive, and all you need is maybe just a computer somewhere at a clinic, at a hospital, at a clinic or a dispensary. You need some internet, and that's why we are calling out for partners who can also support with internet connectivity. And in places where there are no electricity, just a basic solar panel, to help provide energy. And so with that, just having something like that kind of facility, very simple facility in a village. And here, on average, in Africa, on average, a village has maybe close to 10,000 people. You are able to help 10,000 people, majority of whom are women and girls, access very basic health services. And that improves their health, it improves their performance in schools for girls, and it helps to reduce their risks and inequalities, the unique inequalities that they experience in their communities.
And decreases communicable disease transmissions when people have healthcare. It decreases conflict. It increases economic opportunity. The benefits are far reaching. Um, Steve, how can our audience connect with you? I'm sure people are going to want to connect with you after this conversation.
Right. So please, not very active. I'm active on LinkedIn. I'm active on LinkedIn, and you can check me out at Stephen Ogutu. I'm sure you get a spelling on my. You can also just check Steve Ogutu Kenya. You'll see a number of my articles and clips that with interviews like this. You can also reach me out via WhatsApp through +254 702 274278. I think those are my primary ways of through which you can reach me.
Steve is a person of great insight, great motivation, and a great contact. So please reach out if you want to partner in Kenya or support any of the initiatives of the movement for community-led development, Global Telehealth Network, HAEW, etc. Really a pleasure to speak with you. There's so much to talk about. As we do more work together, I'm sure we'll have other opportunities to bring updates.
Great. Thank you so much for the opportunity, Kim. And thank you for your audience. I know you have a wonderful audience. Thanks to them for also listening to this conversation. I hope it's helpful in terms of giving them, maybe strengthening the perspectives they have, or giving them new perspectives, especially around health inequities in Kenya and in Africa. And thank you for making this happen through this platform.
No, I appreciate you. It's wonderful guests like you that help this conversation have context and really connect with people. So I very much appreciate you. In our podcasts, we highlight the voices of innovators, leaders, advocates, and authors who are championing change and equity in healthcare. If you're advocating for healthcare equity, we'd like to hear your story and share your voice on our show. So please contact us at Dr. T, T at haew.org to secure your spot on the podcast. And listeners, please, we need your support. Wonderful initiatives, such as the one Steve and I are discussing, need resources, and your support as a volunteer and as a donor mean the difference and mean a lot to us. So please go to https://haew.org to learn more. You can join us there. You can partner with us. You can contribute. Also, share this episode with a friend. You never know who needs to hear about this and then might want to connect. So please share it. Also, leave us a review and share your thoughts. And if you're interested in being a guest, please email me. Let's amplify this conversation for a healthier and more equitable world for everyone.